Welcome. My name is Chris Layton with the Chronicle of Higher Education. Want to take this opportunity to thank everybody for joining us today for what we hope will be a very engaging and enlightening event regarding the current condition in nursing shortage that we're encountering. Throughout the course of today's two panel discussions, you'll have the opportunity to submit questions. You'll see note cards on the table. Feel free to use those note cards. We'll be collecting them 10 to 15 minutes before the conclusion of each panel, and opportunity permitting, we'll submit those questions to the group. So thanks again for joining us, and I'd like to introduce Dr. Bill Papicello with the University of Phoenix. He's going to join us for some opening remarks. Thank you very much.
Thanks, Chris, and good morning, everyone. I want to welcome you on behalf of University of Phoenix and the University of Phoenix Research Institute in conjunction with our good partners at the Chronicle of Higher Education. What we're going to hear today is about the critical condition and conundrum of nursing in the United States today. And of course, I'm preaching to the choir, but want to set a little bit of a context for what you'll hear. The conundrum is that there are a set of somewhat interesting circumstances that affect nursing in the United States today. For instance, we know that our nursing population is aging and are facing imminent retirement. And yet we have more patients in the country than ever before, needing much more complex health care than ever before. We know that according to the Robert Wood Johnson Foundation and the American Healthcare Association, that technology needs to play an increasing part in nursing education and in healthcare. And yet currently technology is not sufficiently integrated into many of the systems in our healthcare system and in our nursing education. We know that we have few minority nurses and few male nurses, and yet the patient population in the country is perhaps more diverse than it has ever been in our history. We know that the regulatory environment is becoming increasingly strict in all areas, but healthcare especially. This impacts healthcare because this is a time when we have a much more not only diverse but complex set of needs in our patient body. We know that more nurses are needed in the country, and yet we know that that need is uneven. We know that some areas of the country are in dire need of nursing, and there are positions that go unfilled every day, whereas in other parts of the country, there seems not to be such a pressing need. And this is something that we need to address in the education area, where we can bring to bear some possible solutions, although certainly not solve those things. We know that increased education is required in the nursing profession. In particular, we know that bachelor's education is going to become increasingly important. We know that there's a goal for nurses to have a population that is 80% bachelor's educated in the near future, and yet 50% or fewer nurses today are at that level. And that education is a complex one, because as we all know, nurses need to have the hard scientific skills necessary to provide the care that their patients require. And yet, it's a profession that requires significant soft skills in delivering that health care to, a very diverse population, and a population about which we know much more in the realm of health care than we ever have before, and to which we must be sensitive. We know, finally, that there's going to be an increasing decline in the ratio of healthcare providers to patients over the next 5 to 10 years unless we can find ways to address the problems that I've just been discussing with you. Education is no doubt a major piece of how we address those issues. We need to continually refresh curriculum, and we need to look at changes in the field and be out ahead of them as opposed to reactionary. We have to provide access for nurses who want to come back to school, as well as for those who want to enter the profession, but who today are part of that population, which is now the majority in the United States, of people who wish to either change a profession or advance in their professions, but are already part of the working population and need to have education integrated into their lives through innovative delivery formats, including online. And I'm sure that we'll hear about that today. With that, I would like to introduce Dr. Tracey Wilen-Daugenti, who is the leader of our Research Institute, and ask her to kick off the first panel.
I think Chris is going to come up and help us here.
Oh, you can do that?
Thank you.
Okay.
So without further ado, let's kick off the first panel discussion. The first panel discussion is entitled Nursing's Critical Condition, the Shortage, Skills Gap, and the Human Touch. So as Bill alluded to, moderating the panel today is Dr. Tracey Wilen-Daugenti. Tracey is the Vice President and Managing Director of the University of Phoenix's Research Institute, and she's a visiting scholar at Stanford University. Also joining us, our distinguished panelists include Christy Chambers, who is co-founder and principal partner with the Medical Simulation Design Group. Athena Polaris. Athena is the Corporate Vice President of Education at Fresenius. I hope I got that right. Fresenius. Okay, I knew that was going to trip me up. Medical Care North America. And Maureen Swick. Maureen is the Senior Vice President and Chief Nurse Executive at Inova Health System, which is a member American Organization of Nurse Executives. And finally, we have May Weichel, and May is a professor and dean at the Francis Payne Bolton School of Nursing at Case Western University. So with that, I'll turn it over to Tracey.
Okay, well,
Thanks so much.
thank you. Thank you very much, Bill and Chris. So I thought we would dive right into the main topic today, the nursing shortage. And I would like to look to May, as Dean of Education at one of the most historic and most prominent schools of nursing in the United States. Surely, May, Case Western has had a history with seeing nursing shortages, and my sense is you probably have a great perspective on this. Could you tell us your thoughts?
Well, I can start out by saying, yes, I agree, there is a nursing shortage. And even though we hear more and more about pockets of where there is not a shortage, we have to look at the overall picture and some of the goals that we have in terms of educating more nurses at the baccalaureate level. So there is a shortage. We experience shortages in terms of the staff nurses. There's a shortage of staff nurses. There's a shortage of nurse practitioners. And certainly, we have a shortage of staff that can teach in the clinical area. And because that's one of the concerns when we have people who move up the ladder and they get their nursing doctorate and their PhD, we still have to have someone teaching at the clinical level. So there is a shortage of clinical staff. There's also a shortage of clinical places where we can place students. And that is becoming a serious problem, and that's why we are really embracing some of the new technology and online. At Case, I have been there I always say I'm the strand that runs throughout the curriculum. I have been there for 40-some years. I've been dean for 10 years. And I have experienced this up and down of nursing shortage. We had a time when we had to, we thought we would get rid of all of the students who didn't have a baccalaureate, all the baccalaureate degree students, because Case is always way ahead of the game, and just go for nursing doctorate. Well, that didn't work because there was such a shortage. We had to bring back the baccalaureate program, and we ended up with a 4-year baccalaureate program, and we start students out when they're freshmen. And that was a nursing shortage. And so I've seen lots of the shortages where the hospitals will say, okay, we don't need any more, and then they come back and say, we do need. There's a terrible shortage of faculty. We have faculty who are aging, as you said in your introduction. And so that makes a difference too, because we have to have a ratio of at least, well, in our state, 1 to 8 faculty members with students. And also, if you're looking at quality and safety for patient care, we have to have clinical instructors. And so I find that that is a very great shortage.
Thank you. Maureen, let's look at the other side. You're Senior Vice President and Chief Nurse Executive at Inova Health System, largest nonprofit system in Washington, D.C. You employ nurses, so you're on the other side. Are you seeing a shortage?
I do, and certainly I'm responsible now for close to 6,000 nurses, and due to the aging workforce that I see, at least across the system now, I think our average age is 51 for nursing, and in certain specialties, critical care and the operating room, the nurses are upwards of close to 60 years of age. So I'm really concerned about the retirement age of our nurses and looking at how we can better partner with our schools. To May's point, many classes have been canceled at some of the local colleges because of lack of faculty and not being able to do that. So we're trying now to partner with our local schools and have some of our master's prepared nurses be part of faculty and have joint appointments.
Okay. So Athena, let's jump to your area. And I think you might need to elaborate a little more on what you do so people can really comprehend. And you have many RNs, and you also employ nurses.
Yes,
what's your perspective?
We are a dialysis organization, and as a specialty, we do employ about 9,500 nurses. And so what we see is we do see, obviously, a shortage as well across the country, depending on geography. But we see a skill mix also that varies. With the aging group, we have tremendous experience in some areas, and in other areas, we have brand new graduates coming into a specialty. So there's a huge gap of the skills that are going to be required. As far as the shortage, additionally, we have a group that varies in preparation academically. So that is a tremendous challenge for us as well. Associate's degree graduates, baccalaureate, and master's prepared is probably our smallest group. So trying to get everything into a standard of practice will continue. I think we'll continue to have larger gaps before we have smaller gaps. So that's a big concern to me, Tracy.
So, May, some of the experts say if we could recruit more men and minorities into nursing, that could perhaps alleviate the shortage. What's your perspective on that?
I agree with that. I mean, we're really, it's been a woman's profession, and so we've been very slow to bring in males and also more minorities. But particularly males, sometimes it was the nurses themselves that we had to convince that men make good nurses, besides convincing society that men make good nurses. And there's always been a shortage of minorities in nursing. And we've had to look at different ways that we can bring more minorities in to the nursing. And part of that has been going to basically not only high schools but junior high to help them understand that that is a profession that they can go into. And so we have been doing a lot in terms of trying to bring in more minorities, and it can be done. Our incoming freshman class, we have 25% African Americans, and that really is a goal that we've really worked on. And part of that has come about because of our partnership with the community and with the junior high and high schools.
Okay. So, Maureen, we also talked about multiple generations in the workforce and that nurses are not retiring. That silver tsunami that I read about is not happening. for a variety of reasons. The Institute of Medicine's Future of Nursing report recommends that 80% of nurses hold bachelor's degrees. Given the shortage, people not retiring, what's feasible in your mind?
Well, my concern with working with the multiple generations and things that I've come across recently is when you look at some of the nurses with more experience that don't have their baccalaureate degree, it's really how to get them engaged to go on for their degrees. Many of the younger nurses coming in either are coming in with their baccalaureate or quickly enroll in a program. So we have put different incentives in place to help both groups, either through scholarships, flexible work schedules, online programs, and partnering with our local schools have certainly helped engage the workforce. And also our clinical ladder programs, professional development programs, we've offered an incentive in there as well to encourage our nurses to go on.
So you do a lot around retention, it sounds like, to really keep nurses employed.
It's both retention and also to encourage the lifelong learning from a nursing responsibility to keep them engaged in education, and as much as we can do to motivate and make it as easy as possible. Many of these nurses either have second jobs or children's and families, so it's really working with them, staying engaged with them, and making sure as an employer we give them every opportunity to be able to do that as well.
Okay, thank you. Christy, you've been an educator and now you're an entrepreneur, and an entrepreneur in technology. But we talked about how you've seen nurses invest time in their education and then in a 2- and 4-year program, but then leave because the environment is either caustic or non-supportive. Could you share a little bit on that?
I would love to, because it's something that is really sad when I see it happen. Our healthcare environment is so dynamic and so complex that we're talking about very complex systems. We're talking about complex disease processes in individual patients, and we're talking about complex family issues that surround that patient. And not always are our learners or our students prepared to be successful in such a complex environment. They come through school, they pass off skills, they pass off tests, and it seems like it's segmented and they can be successful in segments. And then we kind of throw them into an extremely dynamic, complex environment, and they're not always successful. Not because they don't have the skills, but because they're not prepared for that environment.
Well, since you bring up skills, the University of Phoenix, our institute, we did a recent study and found that the skills needed for the new technologies, so electronic records, data entry, and using in discharge plans just wasn't there. So, Christy, we actually talked about this at length. What gaps do you see around skills and technology being implemented in medical learning environments?
The gap is diverse because of the age of the learners as well as the faculty. I see this as much with faculty embracing new technology, embracing the high-fidelity simulators. It's out of their comfort zone. If they missed that whole technology era, if they did not grow up knowing what an iPod and an iPad